thank you for joining us for the St. Louis Metropolitan Pandemic Task Force Daily Briefing with Dr. Alex Garza. The briefing will begin shortly. Dr. Garza will take questions that have been submitted by members of the media after he makes brief remarks. Reporters who have questions during the briefing may also submit those to the Task Force Public Information contacts, and we will attempt to address those during the briefing or as quickly as possible after it concludes. I'll now turn the briefing over to Dr. Alex Garza. Thank you.
Okay, thank you and good afternoon, everybody. Before we begin here today, I wanted to talk about something I'm hearing a lot of. That's from government officials, business leaders, folks in the community, and even my family. And the question is, when can we go back to work? When can we start to open up parts of the economy and our society that have had a temporary close? And a favorite question of my son's, when can I visit my girlfriend again? Now, some of these are more important than others, but all of them are important. And many of us will like to have an answer and an answer soon. And I'm hopeful that as I walk through my remarks today that we can give you some idea on what we're thinking about for reopening the economy and society. So as a clinician and a father and someone who cares about this community quite a bit, I understand the importance of having people get back to work and to school and to church and all of those other social environments that we enjoy so much here in St. Louis. Your favorite shops and bars and restaurants. What we're doing now is really, really hard. As healthcare professionals, we take it very seriously, the profound psychological and economic impacts of this virus. It is not lost on us at all. At this moment, we're still on the rising side of the curve in the region, but we're also thinking about and planning for that gradual opening of parts of our economy and our lives that have been placed on hold. And we have to make sure this reopening is successful. As we've seen in past pandemics, particularly the 1918 influenza pandemic that I've spoken about in the past, if this isn't successful, the health and the economic impacts will be substantial, and there could be a second wave which would be even more devastating than the first. Yesterday, we saw an increase of more than 100 hospitalizations of COVID-positive patients and patients under investigation, and that was in one day alone. And so that convinced me, and I hope convinced you, that we're still on the rising side of this curve. If we rush too quickly now, too many people will become infected, get sick, and die. And the science suggests that eventually we'd have to do this all over again with closing significant parts of our economy and our society. And the pain of the last several weeks will have been lost if we move too quickly and too soon. Instead, these steps are working. The stay-at-home orders, social distancing, and washing hands should remain in place until we know that we're beyond the peak and that we have robust testing and tracing capabilities in place. Now, there are a lot of committed people from our healthcare system to public health, our elected officials, and our civic community that are working really hard on these issues, but it's still going to take a little bit of time. I know we are all eager to begin to return to something closer to normalcy, and I feel that urgency too. But for the sake of our economy and our community at large, we have to make sure that we do this right. We don't get a second chance of doing this right. So let me take you now to what our actual numbers are. So as you can see, today we have 750 hospitalizations, which is about the same as it was yesterday, where we had 757. I will tell you, though, in communications with one of our hospitals that they recorded the highest number of positive COVID patients, and they were, still are, our busiest hospital for taking care of COVID patients. And that was within the past 24 hours. And his message to me was, you were right about this week being the peak week. We're feeling it here. We're still significantly higher than where we stood when we started this a little bit more than 2 weeks ago. There are 187 intensive care unit patients, which is down slightly from yesterday, where we had 196. And we have 130 patients on ventilators, which is down from 142 yesterday, which is good news. And the other good news is that 43 COVID patients were discharged from our hospitals yesterday. So as of today, our hospitalizations are still up 60% from where we started in early April. Even though many are going home each week, more are still being infected and hospitalized, and the virus is continuing to spread. So this is not the time now to remove those proven steps that we have worked really hard to keep people in this region alive. This is a dangerous virus. It's extremely contagious, and we don't know who has it or how precisely to treat it. We do know how to prevent it, and that's what we need to keep doing. So please stay at home, keep washing your hands, continue to clean surfaces, practice that social distancing while we work to stop the spread. And we'll continue our work on how we can move on to the next phase of this pandemic, which is reopening our society. And for now, that's it for my comments, and I'll take some questions from the media.
With several planned protests happening, why is it important to still maintain the stay-at-home order in St. Louis County and in the St. Louis region?
I think, maybe these slides would be demonstrative on why it's still important to continue to follow those tried and true methods that we know decrease the number of infections, decrease spread, decrease hospitalizations, and decrease death. So we know we're still on the steep part of the curve. And the only way that we can get over this curve and back into an environment where we can start reopening society is to do all of the hard work that we're doing right now. And I very much appreciate, and have empathy for people wanting to get back to normal. But we need to get through this phase and think smartly about how we can start to reopen society so that we aren't in a worse position than we are now.
How does St. Louis County compare to other areas in the region in terms of the number of cases and deaths?
You have to be very careful when you're looking at numbers of cases. And the reason is the number of cases are attributed to the number of tests that are performed. And you've heard me describe previously what our limitation is on the number of testing. So typically the number of tests performed are usually people that have been sick enough to go to the hospital or to go to a doctor's office and get testing. You've also heard me say that there is a substantial number of people that are asymptomatic or mildly symptomatic that have never been tested. And so I wouldn't rely so much on the discrepancy in the case numbers as I would looking at it holistically as a region. And the most definitive data that we have for the region is actually our hospitalization numbers. And so those are more of the numbers that I track when I'm looking through this. And the other thing I think we need to, again, realize is that regardless of where political boundaries are, it still is one large area where the community moves back and forth across boundaries. And so it's difficult to place any, to get any clarity or any sort of discrepancies just based on political boundaries than rather on the entire area.
What would be the health impact of reopening the economy too soon?
Well, I've spoken about this quite a bit. So if the question really is if we reopen the economy, then that assumes that we are increasing our risk of transmission. And so that's really the question is what would be the impact on healthcare if we began increasing the risk of transmission in the community too soon by allowing people to not do social distancing, things like that. And so potentially, and as you've seen from some of the curves that have shown from past pandemics, the potential is a rapid rise in cases. Because don't forget, it's not that the virus has gone away. The virus is still there. And because of social distancing and because of shelter-in-place orders, we still have a substantial amount of the population that is susceptible to the virus. So if you allow the susceptible population to now get closer to the virus is going to spread. There's no doubt about that. So the question is, how can we limit spread? And so what my fear is if we go too fast, it will spread too quickly and it will overwhelm the healthcare system.
Hospitals have indicated to this reporter that the lack of elective surgeries is hurting the bottom line. When we're looking at phasing, when are we looking at phasing in elective surgeries, and can those be accomplished and happen while we're still under stay-at-home orders?
Very challenging question, and one that doesn't have a super straightforward answer. So we are looking now at when can we resume doing some elective surgeries. And just like a phased approach in opening up the economy, it's also a phased approach with doing elective surgeries. So clearly we can't just flip the switch and start doing all elective surgeries again. So for one thing, we don't have the personal protective equipment to open up to doing all elective surgeries again. We have to make sure that we have adequate testing in order to ensure that patients that we are taking in for elective surgeries don't have COVID. And then lastly, we want to make sure that we're sequencing what sort of elective surgeries that we're doing. And so certainly there's some surgeries that are more important to get done on a timely basis than others. So think about things like surgeries for cancer you would want to do more urgently than other sorts of cancers, such as plastic surgery and things like that. And so it's a multi-layered question, one that we do think about quite a bit, but one which also requires us to make sure we have everything lined up so that the healthcare system can be successful when we do start bringing those elective surgeries back online.
If we understand the terminology, the hammer has worked to flatten the curve and create a plateau of cases, but how will the dance work? What do you think will be the first elements of the society to, quote, dance out and gauge the impact on the St. Louis region?
Yeah, it's an interesting question, dance out. So the dance has to deal with how do we modulate protective measures with monitoring how the virus is acting out in society. And so part of that, you've heard me mention these strategies before, is making sure we have active testing and tracing. And so why do I say that? So if we have a very active testing and tracing strategy, then we can identify people that are symptomatic and that have COVID within our communities quickly and be able to isolate them so that they're not able to continue spread. And you can't do that unless you have a very robust testing and tracing platform. The other parts of the dance are how do we develop surveillance systems for the community so that we know if we're starting to increase our number of cases or if we're holding steady. And so that could be anything from some electronic surveillance data for symptom patterns to hospitalization numbers, any of a number of things. And that can help modulate some of the how fast do we go. In terms of opening, what sorts of things could sort of dance their way out faster than others? If you think about this, there's a spectrum of industries where some are at higher risk of transmission than others. And so on one side you could say, hey, the people that work outside far away from each other, like landscaping or construction, are at low risk of transmission because of their environment and how they work. Whereas on the other side, a large gathering in an enclosed space you would not want to do at this moment. And then there's gradations of everything in between. But we have to have those systems in place so we can see where we are at any given time with virus spread so that we can modulate what opens, what things should we put the brakes on, are there any other measures we need to take place to slow the spread down.
Dr. Garza, one question that we've received from a reporter during the briefing today. This reporter writes that one federally qualified healthcare center that is operating testing sites in North St. Louis City says they only have about a week's worth of personal protective equipment for employees. And as a result, after that, they will not be able to conduct testing in North City, which, as you've indicated before, is an area hardest hit by the pandemic without adequate supplies. The governor has also said that a lack of PPE is a new barrier to expanding testing capacity. as the region's incident commander for this task force, do you agree that a lack of PPE supplies is becoming a barrier to testing?
I have not heard that PPE is a barrier to testing. What I've consistently heard is a lack of swabs. So the swabs that we use to get specimens are the primary lack for testing. PPE is this dynamic state. So we have equipment that comes in, we have equipment that goes out, we have equipment that's being used. And so it changes on a day-to-day basis. So it's not a static number that only decreases. And so it's always challenging to say where you are precisely on any given day with PPE. Now, certainly you do need PPE in order to do testing, so you want to protect your healthcare workers. But I personally had not heard of any limitations in doing our testing from a limitation from PPE standpoint. But we can follow up with those healthcare centers to see what we can do.
This week, the state of Illinois started releasing data on nursing homes with outbreaks of COVID-19. Does the task force know of any St. Louis area nursing homes where people have tested positive for COVID that aren't listed in that state of Illinois data?
We really don't track that granular level of data, so I would have to refer them back to public health or somebody that would have that level of data.
The number of new COVID-19 cases reported daily in the St. Louis region seems to be on a downward trend. How does this fit with where the task force models predicted we may be at this point?
Right, so two separate questions. So one is on the number of positive test cases, if I understand the question correctly. And again, those case counts are based off of test results that are usually performed in an outpatient setting where they're sent off to a private lab and then the results come back at some time later. And so, which causes confusion on how you can trend the data. And the second piece to that is there is a limitation on the amount of testing that's done. And so again, it doesn't give you a complete picture of the number of people that are infected in the community. The modeling data that we use doesn't rely on test positive data, it relies on hospitalization data. And so that's why we're very confident when we look at the curves, and I think I showed them maybe about a week ago, and how we are tracking to our modeling, that it's been fairly consistent. And so we believe that we're tracking the right model and that the cases are matching where we think they should be.
The two final questions we've received at this point both also relate to testing. The first, where do we stand generally on the number of tests available in the region?
Challenging question to answer, and the reason for that is there's two different types of testing. One is done in the outpatient world, which typically goes to private labs. Actually, there's three different ones. Outpatient that goes to private labs, and so that's really limited by however much the clinic purchases from those private labs, and so that can be highly variable. There's the amount that we do on an inpatient capacity. So we have a pretty good understanding of how many cases are done in our inpatient status. And then there's the state lab as well, which of the three probably does the least amount of testing. They have very restrictive criteria, and they're using a lot of their testing now for first responders. So on any given day, there is a different number of testing that is occurring just depending upon which environment that you're in.
And finally, yesterday you said that we do not have enough surveillance testing available in the region. Can you please explain, one, why the surveillance piece of testing is so critical to reopen the economy, and two, the number of surveillance tests needed in our area to reach the point at which you would be comfortable reopening the economy? And then as a follow-up from there, how far off are we from that, or how long could it take to get there?
Yeah, I may have to have you reread some of those questions
Sure.
later. In some aspects, we're really far behind in the amount of testing that we can do. And so by that, I mean, let me give you an example of a country that does it well, and that's South Korea. So they began massive amounts of testing early on in the pandemics. And so that way they had a broad understanding of who was infected in the population and who was not. And so then they were able to isolate and quarantine those individuals that were infected, even if they were asymptomatic. And what that does is it prevents spread in the community. Because we've had such a lack of testing, it's been really difficult for us to understand how many people actually have the virus that are out in society right now that are helping spread the virus. And so because of that, we've had to resort to the much more strict methods of shelter in place and all of those other things. So now we're thinking we'll probably never have enough of what's called the PCR-based testing looking for acute infection. So we'll have to be smart about the numbers that we can use to try and understand what is the prevalence of the disease or how much disease is there out in society. And by that, we'd have to develop a very specific testing strategy. Now, there's a second piece to that, which is the immunity status in the community. It's really an exposure because we're not sure how immune they are. And that involves the antibody-based testing. And we believe we can get that online within the next couple of weeks. But again, we'll have to develop a sampling strategy to understand how, because we can't test everybody. So we'll have to figure out a number that says we think this is representative of what this community looks like as far as exposure to the virus. So we don't have a specific number yet. We're working through that with some of our academic partners. But we hope to have a plan ready within the next couple of days to a week to really understand how much testing do we need to do in our community where we feel comfortable, we know sort of where the community is right now with the prevalence of virus in the community.
Thank you. That concludes the list of questions received from members of the media prior to and during today's briefing. In the morning, we'll accept questions from members of the media for tomorrow afternoon's live stream. Thank you for tuning in.